Hi, this is Audra with Sunwarrior. Are your fingernails trying to tell you something about your health? Just as your eyes are the windows to your soul, your fingernails can provide valuable information about your overall health. In particular, the appearance of your fingernails can indicate whether you have mineral deficiencies. So, before you even think of chewing them off, take a moment to see what message they have for you. Take a look at this photo of these fingernails. You will notice that they have white spots. Now take a look at your own fingernails. Do they have white spots, bands, or lines? If so, you, and a large number of Westerners, may be suffering from massive mineral and nutrient deficiencies, in this case, zinc deficiency. So why is this happening? One obvious reason is the lack of nutrition in one's diet. For example, if you are involved in a serious relationship with fast food, processed foods, and sugar, you can most definitely expect to experience zinc deficiency. Other known causes of zinc deficiency are excessive alcohol intake, illegal drug use, long-term exposure to environmental toxins, malabsorption syndrome, chronic diseases such as sickle cell anemia, Wilson's disease, renal and liver diseases. But here are some other groups at risk, and this may surprise you. Athletes and health-conscious individuals who eat whole grains and produce. If you are an athlete, you generally need more zinc than the average person because exercise increases the loss of zinc in the body. You may think you are getting proper and complete nutrition when you consume whole grains and produce, but the truth is we are now eating factory-grown food. Today's grains and foods are often grown in dead soil with high levels of fibers known as phytates. When we ingest these phytates, they bind with zinc and prevent it from being properly absorbed by our bodies. Just how serious is a zinc deficiency? Well, if a deficiency persists, you may experience any one or several of these health problems. A weakened immune system, inability to protect cell membranes from viruses, toxins, and venoms, poor appetite, particularly in the young and elderly, mental lethargy, chronic diarrhea, growth failure or dwarfism, vision problems, fertility problems, failure of sexual maturity, benign prostatitis in men, and menstrual cramping and bloating in women. Essential hypertension, angina pectoris, delayed wound healing, free radical damage, frequent infections, scleroderma, asthma, premature aging, loss of hair color, anemia, stretch marks, joint pain, loss of taste, or birth defects. So how do you fix the problem? Reversing zinc deficiency takes time. But a deficiency can be corrected by adopting appropriate dietary changes and by orally taking a therapeutic daily dose of 100 to 150 milligrams of zinc for a few months. You should also add trace amounts of copper and vitamin B6 to your zinc therapy to help reestablish proper zinc serum levels over time. There is a caution though. Too much zinc is toxic and can be very dangerous, so always check with your doctor before starting a zinc protocol. Here are some plant sources naturally high in zinc. Try to incorporate them into your diet. Cereal grasses like wheat, oats, barley, rye, and wild grasses. Organic, locally grown greens like dandelion, romaine, broccoli, cilantro, basil, and cabbage. Organic seeds and nuts, especially pumpkin seeds, sunflower seeds, Brazil nuts, pecans, and walnuts, and fermented cabbages. As far as zinc supplements, they vary in quality and use. A high-quality zinc gluconate is a great start. If you happen to have eye problems, OptiZinc is highly recommended. Whatever you do, don't miss out on nature's strongest antioxidant. That's right, zinc ions are nature's strongest antioxidants, far more so than vitamin C and E, and much safer than selenium. The future of zinc therapy is very promising. One woman used therapeutic doses of zinc to cure a deadly brown recluse spider bite with no observable side effects, neither nausea nor vomiting. The zinc rapidly eliminated her systemic bloating and generalized pain and caused her wound to heal quickly without scarring. The use of therapeutic doses of zinc in highly ionic forms for treating diseases, wounds, burns, and venomous bites is a fresh and promising area demanding further research. This is Audra with Sunwarrior. Take care of yourself, be healthy, be happy, and remember to sign up for our newsletter if you haven't already. Thanks.